Hey guys, so today we're going to be talking about the benefits of a Medicare for All single payer program. Single payer is where a government is a single health insurer for an entire country. Every other industrialized country in the world has single payer or some form of a single payer hybrid system that provides universal health care to its citizens. The United States is the only one of 36 industrialized countries in the world that doesn't have a universal health care system. So in this video, I'm going to go over the benefits of implementing Medicare for All in the United States. So let's go ahead and go. First slide. Private premiums, copays, deductibles, out-of-pocket expenses, and surprise healthcare bills are gone. That's huge. That is about $11 trillion of value that usually comes out of the pockets of individuals just gone. It's instead replaced by taxes, essentially. Moving on to the next thing, 100% comprehensive healthcare coverage for medical, dental, vision, hearing, mental health, maternity, and long-term care. That is one hell of a deal. So just think, you can go in for emergency heart surgery, if you had a root canal, if you need some eyeglasses, you need some hearing aids, you were a mess and you need to see a counselor, you were having a baby, or your grandmother needed long-term care, it would be there in Medicare for All and 100% covered. That is a hell of a deal. It will be free at the point of service, meaning you will probably have something like a Medicare card. You will go into any hospital, doctor you want, show them your Medicare card, they'll treat you, see you, and you are on your way. There's no co-payments, out-of-pocket expenses. You just go, you leave. And the reason for this is because the system is financed through taxes instead. This means you can use services as you please without having to pay for them because you're already paying for them through your taxes. So there's one caveat in the Medicare for All plan where you actually do have one deductible, and that would be for this. No more than $200 in out-of-pocket expenses for prescription drugs a year. And this is a great deal. I mean, I don't spend $200 on prescription drugs a year, but I know a lot of people do. So basically, when you hit that $200 cap is a deductible, you will no longer pay anything else out of pocket once you hit that cap. So that's great for people who spend thousands of dollars a year on prescription drugs, like our seniors. Next, private healthcare expenditures are off the backs of small businesses. This is great because health insurance is such a huge burden on small businesses. I can't remember the exact cost it usually is, but we're talking like over $10,000 per employee for a lot of businesses to get health insurance. It's very expensive. This would be replaced most likely with a Medicare type tax on employers. I know Bernie Sanders had one of 7.5% on employers, actually exempting most small businesses, and Elizabeth Warren had it at about 98% of what they're currently paying. So small businesses are definitely going to be saving money from the implementation of Medicare for All. So let's go on to the next slide. So 87 million Americans would no longer be uninsured or underinsured. It is crazy that there are like around 30 million people in the United States that don't have any health insurance whatsoever, and then about 47 million more who are underinsured, meaning that they have very high premiums, very high deductibles, that you just can't meet it. Like their insurance company would have a $10,000 deductible. You just can't do that unless you're super wealthy. So with the implementation of Medicare for All, I mean, these 87 million people are covered. And just think also recently with the coronavirus, at least as of today, there were 30 million people who have filed uninsurance claims, and you had to say at least a third of them have lost their health insurance. So we can add that about 10 million more who would actually have health insurance in this instance if we did have Medicare for All in place. Okay, and then 500,000 people would no longer file for medical bankruptcy every year. It is insane that if you are poor enough and you go to the hospital because God forbid you have, a heart attack and you rack up a big bill and you just can't pay it, you might have to file for medical bankruptcy. And I mean, that means they can come and take your home, they can come confiscate some of your assets if you can't fork it up. It is just insane that in the wealthiest country in the world that we do not have the protections to prevent medical bankruptcies like this. And this is just a stunning statistic. 68,000 Americans die every single year due to lacking health insurance. This means they don't go to a doctor when they should. And it's because of the costs. It just scares so many people. That is just insane that we have a system like that. I mean, it's so immoral. I'm sure in some recent wars we've had more people or less people die than we have people die every single year due to this issue. And then at least 50 million Americans would no longer see their health plans changed every year. Yeah, so we always hear about, oh, if you implement Medicare for all, you're going to kick 150 million people off their private health insurance, but at least a third of those every single year get new health insurance plans anyways, and they have no control over it. It's usually because the employer is in charge of that. So, and it's just something to know. And this is very important. Every doctor is in the same network. And the reason for this is because the federal government is the single health insurer, and there's no one else. The doctors have no one else to turn to, just the federal government. So that means everyone's in the same risk pool, and anyone can go see any doctor he or she pleases. Now, I'm not saying that you won't have a waiting list, but you will have literally access to see that doctor if they're seeing new patients. And let's go to the next slide. So Medicare for All would save $4.5 trillion on healthcare spending over the next decade. That is insane. That is awesome. And this is according to a recent Yale study. There are 22 other studies, I believe, that I've seen that show savings from Medicare for All. One of them being the Mercatus study. Libertarian think tank actually had a scenario where Medicare for All would save $2 trillion. The Political Economy Research Institute said we'd save $5 trillion. Now Yale's like $4.5 trillion. There's probably obviously going to be some savings with Medicare for All. And this is largely going to come from savings on administrative cost. For private health insurance, the administrative costs are sometimes 10, 15, 20, 25% in total, whereas Medicare's is around 2%. Huge savings come from that, and the reason why is because the employees at hospitals no longer have to deal with all this health insurance paperwork and fighting the health insurance companies. So it just gets all that bad stuff out and saves us some money, which is great. And there's also some prescription drug reform that saves us some money as well. And according to the same Yale study, the average family will save $2,400 a year on healthcare spending. That's great. That will reduce income and wealth inequality, which is great. And then health insurance is no longer tied to a job or marriage. This is huge, very important. The fact that we even tie health insurance to a job is insane to me. I mean, just think, we had 30 million people this week apply for unemployment benefits. At least probably 1/3 of them have lost their health insurance. Had we had Medicare for All in place, these people would still have their health insurance, and it would be pretty damn good health insurance. Yeah, the fact that we tie health insurance to a job, I just don't get it. Doesn't make any sense to me. So no more fighting with health insurance companies over costs or coverage. Yes, I personally deal with this, and I know millions of others deal with it. It is the biggest pain having to fight the insurance company over something that they didn't cover. It's just ridiculous. And let's go to the next page. Oh, and this is just great. Unions can now devote 100% of their time to boosting wages and improving working conditions instead of spending half their time fighting for better health care. Yeah, unions spend around about probably 50% of their time just fighting for healthcare benefits alone. Just imagine now that they can use 50% more of their time to fight for better wages and working conditions for workers. It's going to be a huge boost to employees. And then finally, no more being ripped off by private health insurance companies to the tune of $100 billion a year. The fact that we have a system that profits so much off people's well-being just really disgusts me. And with Medicare for All in the picture, those private health insurance companies will not, well, they're going to be barred from providing the same coverage that Medicare for All does. They can probably provide, insurance for nose jobs and some plastic surgery, but the important stuff, the health insurance companies will no longer be able to cover, so they're out of the picture. As a good riddance. And that basically concludes it. Here are the sources right here. I will just go quickly through them. And yeah, that is the end of my video. So, hope you enjoyed.